right now? Morning, everyone.
Yes.
I'm Michael from Copenhagen. I met some of you some years ago in Medica. So I'm gonna try to take you through the EMTT technology and the combination with Shockwave as well. Just some small disclosures. I'm working for stores, some different distributors in Shockwave. I also work in US with a education brand. Basically, I'm working with Shockwave 99% of my time. Shockwave is all that I do. So I do around 3,500 treatments a year, mainly in orthopedics and urology. I've been doing around 34 million pulses with the EMTT. I was one of the first users in the world. I started with it during the lockdown in 2020 in Copenhagen. For me, Shockwave is a business. So I had a 400,000 euro turnaround in my clinic last year, and that is in Shockwave and EMTT as 9% of the cases. And I'm the only one in the clinic. It's a one-man business, so for me, Shockwave is quite profitable. The things we're going to go through in the next hour is the theory about the EMTT. We're going to look into how we can use it in clinical practice. And then we're going to talk a bit about the combination therapy, because that's where we're going to see the biggest effect, as you already know, with the focus device, the radio, combined with laser. I know that you also run with the Sumus P4 laser. I also have that in my possession. So we're going to try to make it a bit simple. The reason why we should use EMTT in rehabilitation and orthopedics in general is that it's non-invasive. It's safe for the clients. It's easy to use. We don't need to stand with the applicator to work it. We have the holding arm. It supports all the rehabilitation that we're doing. And then, as I showed on the previous slide, has a very high return of investment. I'm going to go into the economics in a bit. But the basic thing is we have the non-invasive way to treat the clients. When I got the machine, I was approached by stores as one of the reference to take the machine. There wasn't that many studies. So I started with indications that are new. And that was knee osteoarthritis, because I've been working with that with laser before with good results. And we also had the PEMF technology that the EMTT is a development on, which showed that we could use it for arthritis. So I used the WOMAC score to see how these clients would respond on 3 treatments within 10 days. So this is after the treatment on the pain and the stiffness, and this is before. So we go from moderate to mild in most of the categories. Then we look at the difficulties during the daily activities, and that is actually the most important thing, because it doesn't matter if you have pain, you can live with that. But if you can't do your normal activities, sitting in a chair, getting out of bed, walking on a surface, going getting your groceries, and it's a problem. So after the treatment, we had mild in all the cases, and this was where we were before. So something was mild already. But even from the severe degrees, with bending to the floor, walking a flat surface, for this one going shopping, we reached a mild degree of difficulty. So this is quite good. With a group of 10 people that I work with, 30% reduction in pain in general, 45% less stiffness, and about these 37% less difficulty. This is 3 treatments. EMTT alone, 4,000 pulses, 5 days interval. The thing I started doing afterward was combining with the focus device. So I did this initial treatment combined with focus. Then I did a treatment after 1 week from the baseline, 2 weeks. Gonna add. Then I did 1 week, 2 weeks, 3 weeks, until we reach this point where everyone is capable of maintaining a high quality of life and not going to treatment anytime. So right now, these people coming in with arthritis are coming in between 6 to 8 weeks between sessions now, having 4,000 pulses of EMTT and 2,000 pulses of focus device to the knee osteoarthritis. Then they can keep up their daily activities, they can do their training, and they can be more enjoyable of life. So that is quite good from the combination of this. When I used laser before, I often saw that we had to do weekly treatments, and it was still a bit, it worked, but the result wasn't that long lasting. So the combination of the EMTT and the focus device really make a difference. So when we look into the physics, then I assume most of you know the PEMF technology already. So we have the power supply, we have a diode, we have a capacitor, we have the switch that's going to turn on and off the electricity, so we can create this magnetic pulse. The most important thing is that it's a sinus-shaped magnetic field. The amplitude of the strength of the field is between 10 to 80 milliteslas. But with source, instead of measuring directly at the coil, they decided to do it in 4 centimeters of depth in the tissue, because it doesn't really matter how much energy you produce right here if it's not going into the tissue. So that is where we have the big difference between the PEMF and the EMTT devices, also in the marketing. That the PEMF devices will be marketed as 2.4 Tesla, 3 Teslas, but that is in the base of the coil. Then we have the isolation that's going to reduce the intensity and power going into the tissue. We have a very high oscillating frequency with the EMTT, and that is also why we're getting more power into it. We're getting more power into the tissue. When we look at the two technologies, then before we have a half oscillation with the PEMF device, we already been doing the full pulse train of the EMTT with 18 oscillations. So it's very, very fast. And it also makes that the absolute field strength of an EMTT is approximately 40% bigger than what we see with the PEMF device. So if you already know the physics and basic about laser therapy, then you know that the level 3B laser, that going in around 5 to 10 millimeters into the tissue. If you have a laser like the Zoomers, then we have the ability to go into 10, 12 centimeters in the body with enough energy to create a difference. But we're gonna go back to that in a bit. This is how the energy is distributed. So on the left side, we have the EMTT. On the right side, we have the PEMF. Now I just put the Zoomers laser on the left side with the EMTT and level 3B laser at the right with the PEMF. So when we look at it again, you can see how much energy is going out from the beginning. And on the axle, we have the treatment depth. So we're reaching about these 15 centimeters with the EMTT, where the PEMF on the left or the right will go around these 8 centimeters when it peaks around now, and now it's starting to decay again. So again, look how powerful it is, how big the field is. So this is why we can really make a big difference with the EMTT compared to the PEMF. It's the same when we look at applying 1000 joules with laser to the tissue. If we do 1000 joules with a 500 milliwatt laser, it will take 33 minutes and 20 seconds. If we're gonna do it with the level 4 laser, just 10 watts, it will take 100 seconds. That's 1 minute and 40 seconds for delivering the same energy. So there's two aspects in it. The one is how deep can we penetrate the tissue? Can we get sufficient amount of energy into the tissue? And how long time do we need to do it? So for me, with the setup I'm running, it's more efficient that I can deliver the energy faster than having to sit for like more than 30 minutes to apply the same amount of intensity and energy. The next thing is that when we look at the penetration, one of the reasons why that the EMTT is so deep penetrating is the design of the coil. So we basically have a wire that's wrapped inside. It's basically like this with the wire I have here. It's wrapped a bit. And then we have a small isolation. If we take the PEMF device, then most of the coils will be like my phone. I have the screen right here. That is where the energy is coming out. But on the backside, nothing is happening. That's isolated. So in that way, we're gonna have a dual treatment zone. So if my hand is the applicator for the EMTT device, I'll have energy on the left side and on the right side. So you can actually do bilateral treatment of the knees. So if you have a client with medial knee osteoarthritis, you can place a coil between both knees and then treat both knees in the same time, saving time again. So this design really makes a difference that we can have a deeper penetration. So when we look at it, you can see the isolation here on the right side is very flat. Normally the PEMF coils is flat. We have this about 8 centimeters of penetration depth. So we need to penetrate the skin, and then we need to look at how deep we're going to go. With the EMTT, about these 16 to 18 centimeters, so that is more than enough to reach most parts of the body, especially if we have the more healthier population. Of course, if there's a high degree of obesity, then we'll be limited, but then we can work just like with the shockwave or other modalities with compressing the tissue so we can go deeper with the energy. The next thing is also kind of similar, like the level 3B and level 4 laser. That is, when do we start to lose the energy? We know from laser that we lose approximately 30% per centimeters we're going down. So then we need to have a high output in the surface of the skin in order to reach the deeper structure. It's kind of the same with the EMTT and PEMF devices. So with the green line, we have the power of the magnetic field with the EMTT, and the blue is a PEMF. So we can see until around 5-6 centimeters, we're still gonna put in 80 millisieverts with the EMTT device. Then it starts to decay, and when we reach around these 15 to 18 centimeters, we still have about these 5-10 millisieverts that's needed to get the biological change in the tissue. Just gonna admit one more. 2 seconds. Last one, welcome to join. With the PEMF device, we start at 45 millisieverts at the surface of the skin, and it starts to decay quite fast. So when we reach around these 5 centimeters, there's about 15 millisieverts left. So when we look at this slide, bear in mind that the PEMF device normally produces 2.4 teslas at the base of the coil. But that is the maximum strength in the inner part, but it doesn't create the same power in the magnetic field. So that is the biggest difference, and that's also why it can be a bit confusing, because it's still magnetic, it's creating pulses, but the way of generating the oscillation frequency, that is where we have the big difference. So again, another way of displaying how we get in the energy. With the PEMF device in the blue line, we have a lot of energy at the source of the isolation, but it's also a fast decay. With the EMTT device, it's a bit more linear. So we start around these 80 millisieverts, and then we keep the energy stable for a long duration into the tissue. So already at these 3 or 4 centimeters, then the PEMF device will be lower in energy, and it won't be able to create the same energy in the same time. So if you have a injury, very superficial, you can maybe use the PEMF device, because it will still put in a lot of energy in this 1 or 2 centimeters, but you still need to do it for a longer duration because of the lesser transduction power. And that is the next thing we're going to look into, that we have, like with the laser, I'm just going to use this reference because you all know it. You have the level 3B that's compared to the PEMF devices. It takes a long time to get in the energy. It's like with the power output in watt and energy in joule. So with the BTL and the SIMA units, that's been the leading for many years, because that's been what's present in the PEMF devices. We have around these 28,000, 42,000 teslas per second. The limit for EMTT is 60,000 teslas per second. So the EMTT is producing around these 65,000 because of the very fast oscillating magnetic field, the higher pulse train, and then that we're measuring 4 centimeters to the coil. So we're measuring the energy in the tissue. So that is why we have the main difference. That is that we're putting in more energy in the tissue per second. So if you want to do an efficient treatment, then we want to have more energy in, just like with the laser. With the radial shockwave, everything is delivered in the base of the skin, and then it's getting less and less when we're penetrating the tissue. So we want to have a good output, and we want to be stable all the way down. So you can see it here, we have the small devices and the big devices. You can't really compare it. It's based on the same technology, but the probabilities of each technology is very different. So PEMF is compared to level 3B lasers, and the EMTT is like the level 4 lasers. When we look at the contraindications, then of course, when we work with magnetic field, everything that's sensitive electronic equipment is a no-go. So please don't apply it over a pacemaker. It will fry it. Don't use it over spinal implants. You can use it on the heel if they have a pacemaker. That's not a problem, but just be cautious about not doing it directly on top. Then there's also, of course, pregnancy, fetus in the treatment zone. You can still treat the foot, but don't treat the fetus. It's the same with the brain. We're not treating the brain with the EMTT device. Then you will say, we already know that PEMF devices is being used to treat depression. We do it in Denmark on the National Hospital, but we don't have the studies on how EMTT and the faster oscillation frequency is affecting the brain waves. So no brain in the treatment area, but you can still work around the jaw and you can adjust the intensity. The next thing you need to be cautious about is, of course, tumors in the treatment area. We don't want to activate the cancer. Then we have tattoos and permanent makeup. That is also something we need to be aware of. All through that in the European Union, as we're all a part of, there's just been regulation on what kind of ink you can use for tattoos. But back in the days, then there was a lot of metal in the different types of ink. So if you have older people with old tattoos, be aware that there can be ink that can react to the magnetic field, creating a heating of the tissue. The same with permanent makeup. If you have implants, it could be a total knee replacement. If they're not marked as MRI safe, then you need to be aware. If it's the old steel implants, it can carry the magnetic transduction energy and can create a bit of heating up of the tissue. But this heating of the tissue is consistent to about 1 degree, so it's not dangerous. So if you're in doubt, observe the client during the treatment. Just let them know this is safe. Because we don't know about your implant, it can perhaps create a heating of the tissue of 1 degree. Let me know if you start feeling anything. Otherwise, you can be completely safe. I've been treating several metal implants without any problems. They rarely feel it. So just be aware that if it's MRI safe, as most is in Denmark, the Nordic country, most likely in Greece as well, then you can just carry on. When we're coming back to the economic about the device, I don't know what the price is in your country, but the applicator has a 25 million pulses lifetime before you need to change it. So if you're already working with a focus device, you know that after 1 or 2 million pulses, then you need to change the coil. We don't need to do that with the EMTT. So I'm using my coil very extensively. So I produce around 1.3 million pulses a month. So I will change it approximately every 2nd year. Then there's of course a price, but when I look at the combined treatments, the economy in the clinic, then it's nothing. With maintenance, it's also really efficient. Just like with the focus device, you're gonna change the water in the system every 6 months. So that is basically nothing. It takes about 6 to 8 minutes, then you're back and running. The same when you need to change the applicator or when you get the device, you can put it together yourself because it's the same system as the focus device. You can just plug it in, plug it out, then it start up, it put in the water, and then you are good to go. So local replacement, you don't need a service technician to handle all the equipment. And in these about 3 years, I've been working with the EMTT, I've been having 0 downtime on the device. So that is really good. If we look at the mechanisms for the device, then we have degenerative joint diseases, pain therapy, and sport injuries. That is the main indications we're going to work with. So everything about arthritis, herniated disc, spondyloarthrosis, everything about lumbalgia, non-specific back pain, tensions in general, inflammations, tendon overuse, and osteoporosis. That is what we have the main indications for. That is also what is backed with the studies. We all know that to have a device approved for the European medical CE, then there needs to be studies behind the different indications. So we have them here, and you can also have them afterwards if you want to. The main biological effect is that we work with the cells. It has a positive modulation of the cell. It reactivates the natrium pump. normalize the membrane potential, the electrical potential in the cells, and then it activates metabolism. So let's take this picture. You're driving this very nice Porsche because you have a profitable business, and you're driving it on a 6-track highway, but it's completely blocked. So you can't use your 500 horsepower to just go all the way down the highway. Then we put on the EMTT. That is removing that traffic. So it's making everything go easier in and out. So now you can go full throttle on your car and just go 300 kilometers per hour down the highway. So we're making the EMTT modeling the cell, so everything is going easier back and forward to increase the healing probabilities. Some of the belief effects we have with the device is that it induces elasticity. We know it's stimulating the nerves, but we don't have the studies for it yet. It stimulates circulation and it creates muscle relaxation. These are some of the effects I've been talking about with Dr. Gerdesmeyer, Dr. Noblock, that due to the high degree of Peyronie's disease.
Menciona seminario.
Say again? When we look at the amount of Peyronie's cases I have, that is a fibrotic disease. Then I could see the combination with the focus device and the EMTT created faster results, and that is due to the elasticity that's created in the tissue. The same with the nerves. That's also why we have all these very nice indications with pain. I also see that sometimes when I treat my shoulder patients, they start talking about they can feel it's getting more warm. There's no metal, there's nothing else than just a magnetic pulse, but they can feel the circulation increasing. So that is very good. That's also why we can use it for instance, sprained ankle in the acute phase. We have different studies. I'm going to go through a few of them. One of them is in a bone marrow edema. We have Achilles tendinopathy and we have low back pain. All very common indications in the clinic. So if we look at the Achilles tendinopathy, this is one of the first studies that's been done. 53 patients, 8 treatments over 4 weeks, so 2 times per week. And they could see that the VAS decreased significantly. Of course, they recognize it's a novel technology, but it justified that we can use it for reducing the inflammation and the tendinopathy. They also say we should look into it and compare it to the focus device and the radial pressure rate, because that's where the similarity of the technology is. So when I look at my top 5 indications, tendinopathy, of course, back pain, arthrosis, fibrosis, and inflammation. And another thing that's really beautiful of the EMTT device is that we can combine it due to the applicator doesn't need to be held by me. So for this case, I'm treating Achilles tendinopathy in the left foot, and I'm treating arthritis in the right knee with the focus device in the same time. So we can do more efficient treatment. I can even do the treatment of bilateral plantar fasciitis on the same time. So on the one foot, I'm going to have the EMTT, and on the other, I'm doing the radial or the focus device, and then I'm switching. If we look at the rotator cuff tendinopathy, I'm quite sure most of you have quite a lot of these clients. There's already been done some very nice studies on a focus device and radial device for the calcific deposits of the rotator cuff. And now we do the combination of EMTT and the focus device. 86 patients, they all responded better when they had the combination of the focus device and the EMTT compared to sham EMTT. So this is really interesting. So we can decrease the amount of sessions we're going to do. We can increase the output. We will have more happy clients in a shorter time. So that is going to help us grow our business. So the reason why it's so unique is that we have this ability of reaching deep structures. That's also why osteopubis is one of the good indications. We can go deep without creating discomfort for the pain. And just like when we work with the focus device, we are very specific. So if you have specific pain, you're going to work with a specific treatment. That would be the focus device. If you have more diffuse or large pain, then you can work with the EMTT. So for instance, let's take the shoulder. The clients come in and say, I have a pain right here, right here. Okay, then we're going to work with the focus or the radial. If you say, I have pain like this, then it's a bit more general, then we can work with the EMTT or we can combine it. So it's not invasive, it's secure, have a high comfort because we can just sit with it. It doesn't create this same intensity as we know from the focus device for the clients. And then it accelerates the results we achieve with the combination of therapy. So when we look at some of the data, this is actually back from 2020 when I started working with the device, and I think we were perhaps 10 or 15 guys in the world. So the most popular indications was the soft tissue. There was different tendinopathies. Then we have different indications in the spine and back, and we had the changes in bone density and structure. So that was fractures. It was bone marrow edema. The interesting part was that we didn't have any specific protocol at that time. So we all sent data down to Storz, and the plot on your right with the pulses applicated is like the average of what we're doing. So I know that Dr. Knobloch was in the lower end of the spectrum with the 2,000 pulses, in some cases 800. And the one you see with 8,000 and 10,000 pulses for different indications, that's me. I was going in the other direction. But in general, we reach around these 4,000 pulses per indication. The next thing is also that we have this encephalopathy where we can see the decrease from session to session. So from a VAS of 8 to 7 or to 2 in 7 treatments, that's quite impressive over 3 weeks. So we really have our ability to create a big change in the tissue. So when we look at the standard protocols right now, we have the different indications. They will be from 2,000 to 3,600 pulses. That is the official protocols for the moment. 8 sessions in general, 2 per week. We're gonna use as high energy as we can. So these 70 to 80 millitesters, just like with the Shockwave, we're gonna adjust it for the specific client. So instead of just saying, I want to reach level 8, if it creates a bit of discomfort or intensity, it can do that on the shoulder or the anterior part of the pelvis. Then we just decrease it. It doesn't matter. The reason why there's a difference from the rotator cuff and the Achilles tendinopathy is, of course, because of the size of the tendon. The Achilles tendon is the strongest and biggest tendon in the body, so it needs to have more energy put in to create the healing response, just like if we're working with the laser or the Shockwave. Then we, of course, also have some experimental indication. That is what we have on the right. That is different arthrosis. It's neurology in the face. I've been having a client with facial paresis. We had some good results with the combination of the EMTT, the radial, and the focus device. When we look at the practical application, then we, of course, have some ranges with frequency 2 to 3. The reason why it's 2 to 3 is that's also where we've been doing a lot of studies with the focus device in the past. So for me personally, I use the frequency of 7 or 8 or 10. But if you're gonna do right here, it's gonna take a bit longer time. So the duration of the session will be 10 to 20 minutes if you do the 2 or 3 hertz. If you do the 8 or 10 hertz, then a treatment of 3,000 pulses will be done in about 6 to 7 minutes. The way we can applicate is we have the holding arm. You can see it here on the back. You can also use it on the shoulder, of course, or you can use it dynamic. For me, 99.9% of the time, then I'm using the holding arm because then I can do therapy in another region in the same time. And of course, for the heel. So this is just the classical. And one thing I want to go into now, we're about halfway through, so we have good time for questions as well, is how I do my treatments. So you all know the basic setup from Storz. If you have the combined amount of devices, then you will start with the B-actor, you will go into the radial unit with the standard transmitters, then you can work with the spine, the fascia, and the vacuum axis. Then you're gonna go to the focus device for the more specific part, and then you can combine with the EMTT. The way I've been setting it up is like this. Because we don't work with the gel for the fascia treatment for the periaxis, I always start with that. Because then I can work the fascial system, create this range of motion over the joints that I want to, and in the same time, I'm identifying different trigger points or painful areas. So that is the first thing. I use a few minutes on that. Then I go to the V-actor to relieve these tension, especially if we work with the shoulder. There's a lot of tissue that we need to address. So we're gonna do the special system in the beginning. Then I put on the gel. I do the more tender points. I'm gonna make everything relax. Then I go to the radial part. So I'm gonna do the trigger points. I'm gonna work with the large muscle area. So that could be the supraspinatus, take the trigger points and the large area in the same time. When I'm done with that, then I'm gonna go to the more specific. So if we have the calcific deposit, then I'm gonna do it specific there with the radial and then the focused. Then the last step I'm gonna do is gonna combine with the EMTT, the manual, the rehabilitation, the laser device, what else you have of equipment in your clinic. That is my setup, and it's made to be efficient. So the reason why I start a bit with the fascial is that it can be a bit painful, but you also see where you have the different tender points, and the de-axle will be very nice. You're gonna smoothen up the muscle. It's gonna be very gentle. Then you're gonna go to the radial and the focus. That's a bit more intense. And then we have the ability to making the client relax before they leave the session with the EMTT, because of 8 out of 10, they won't feel anything on the way it's developed. So then we go from something that's a bit gentle to intense, and then again, a gentle treatment. So when they leave us, they have a good sensation in the body. In the same time, we're prepping for doing manipulation. So whatever we want, or if we're only doing the EMTT as MyStep 5, you have time to talk with the client, do further education of them, or write your journal. So we have some really good options here. So if we look into some of the different cases I've been having in the clinic, Achilles tendonitis, you already seen the guy. He also have arthritis. He's in his late 40s, family man, having a company, and then he, of course, also doing triathlon. So he's regularly coming in with different injuries. So in this case, it was Achilles tendonitis that was the most prominent thing. We did 6 sessions with 4,000 pulses combined with the focus device. I tracked it with the ultrasound device. I do the scan in the initial session, and then I do it every time to see how is inflammation going up and down. So in a case like this, then we have the ability to decide where we're going to work with the EMTT compared to the focus device. We know that the focus device can also reduce the inflammation, but it also creates the intensity and the pain. So for the first sessions, we just did the EMTT to reduce the inflammation. When the inflammation was a bit down, then we had the focus device being put in place as well. And it's, of course, also backed by the study that we saw before, but the combination is where I see the best benefit. So in this way, we can treat him, we can relax. I can sit and talk about his overload. He's getting these injuries because he's training too much and recovering too little. So then we have time for doing the different education. Can you please turn off your microphone? There's someone's talking. Then we have non-specific back pain. Also a very nice study done in Germany and Austria, where they did these 8 sessions 2 times a week. This is one of Denmark's best elite swimmers in the younger ages. So now it's a few years ago, it's back in 2020, but she's now on the national team. Due to the lockdown in COVID, the pools was closed. So these most ambitious swimmer went into open water. When you do the open water, you need to navigate. So you're getting more tension in your back. So I'm normally working with her once a week using the radial, the focus device to relieve all this tension. Now there was a good case of just having the ability to try with the EMTT. So we did 1 treatment of the EMTT of 4,000 pulses around the lower back area. When she moved from the table right away, she had less tension and increased range of motion. So even through some of these treatments for the more pathologically cases will be over 4 weeks, then we can feel immediately resolve after the first treatment. This is one. I also have another client in the same way, female in the mid-50s, been having prolapses in the back. So she always have pain. We did the 8 sessions over 4 weeks. We went from her not being capable of sitting for a dinner party without having pain and severe pain the day following to being able of going out for dinners. She could go dancing again, and she could do her work without having this extra bill. So now she's coming every second to third week, having one treatment where we treat the entire spine with around 10,000 pulses from the neck and down to the sacral area, and she's good. We don't even combine it with Shockwave for one treatment, approximately 2 to 3 weeks intervals, and then she's good to go. She has increased quality of life. She doesn't have problems at work anymore. And that was after the initial baseline of these 8 treatments. Then I did after 1 week, 2 weeks, 3 weeks. 3 weeks is about the optimal for her. And then we're just working with that. So also quite impressive. Then there's the next thing, clavicle fractures. I've been in triathlon myself. I even had a fracture on my own. So I know how long time it takes to heal. With the focus device, with the lasers, we know it's going to have a benefit. We know it can increase the healing. But with the focus device, it's also intense. It feels pain. So with this guy, I decided just to try with the EMTT. We gave him 3 sessions of 4,000 pulses. He had a quicker bone formation and he has less pain. And less pain is quite important because then he can also start working a bit more efficient with the rehabilitation. So even for the fractures, we have some good cases. The first fracture I did in Denmark was an ice hockey player that had a scapuloid fracture. So he was, of course, put into orthosis, a cast, and we just sat him in the clinic with his hand on the table. Then I put the applicator on top, decided to give him 4,000 pulses, and I asked him to tell me if he started feeling anything. After about 500 to 600 pulses, he said he could start feeling this tingling sensation within the bone. So because of the cast, it wouldn't be possible to do the shockwave treatment as I normally would do. I wouldn't be able to have access with the laser. That could be a secondary option. But with the EMTT, because of the magnetic field is traveling through all the material, then we could do the treatment. So 4,000 pulses, 3 sessions for that guy as well. Quicker formation of the bone. He had less pain, also very important. He was still doing his training, even though he had his arm in the cast. These ice hockey players is quite tough. Then we also have a severed tendon. In this case, we could use a laser, we could use a focus device, and we can use the EMTT. If we use everything, we'll have some really good results. But with the wound, we need to take off the dressing if we want to use a laser. We also need to do that if we want to work with the focus device. So for this case, because he is a bit messy, he's a craftsman, so he always work and get dirty. Then I decided just to do the EMTT. So we did 3 sessions, 4,000 pulses. It's like the general approach I have, 4,000 pulses, 3,000 pulses. He had a quicker healing. From the first to the second treatment, we could see a reduction in the swelling and he had less pain. We could also do the focus device if we wanted to. We could work from the ankles without taking away the dressing, or we could take off the dressing, use a sterile gel, a sterile film, and then apply the focus, combine it with the EMT for even faster results. So now, because you're actually being able to see it on the screen, you can see how blue this ankle is. Again, this is actually my elite swimmer. She twisted her ankle during the open water swim. So 4,000 pulses, 4 sessions, less pain, reduction of swelling. The next thing, if we're going to work very holistic with a case like this, is that if you can get them within the first day or second day, then you can use a radial device for reducing the tension in all the muscles of the lower leg and the calves. That will basically make the client pain-free. So if you can remove all the tensions in the lower leg and in the muscles of the foot, then the pain will go away because we don't have any nerves going into the ligaments that's most likely being torn or stretched during these sprains. But with the muscle and the tendon that's going to have this trauma, there will be pain. So you can use a radial to loosen up the muscle, reducing the pain. Then you can actually have the client going from the table, coming in on crutches to walking out of the clinic without any discomfort. It doesn't take away the specific injury in the ankle joint with the instability, but it will take away the pain. Then you combine it with the EMTT for increasing circulation in the ankle to increase the healing, just like with the laser. And then you can even do the focus device on the torn ligament to induce the formation of human tenocytes that will increase the healing. So the traditional way to approach the bruised ankle would be icing. We would use the laser. All of you guys that have the Sumus before, you will use the laser for that indication. But today, I'm using the EMTT in the combination with radial and the focus to create some really good results. If they don't respond with that, then you just add the laser if you have the time. So you can use it in many ways. Calcific tendinopathy, I'm gonna swirl a bit around that because it's really interesting. In 2020, we had a study coming out of Egypt where they did 3 groups of treatment. They did one with radial shockwave, they did one with focus device, and then they did a combination group. So the result they had was that both the radial and the focus was capable of decreasing the calcific deposit in the rotator cuff. But the most interesting thing was that when they did the combination, they had even bigger, significant decrease in calcification compared to the groups where they only did the focus device or the radial. So if we take this calcific deposit, as you can see in the ultrasound, we want to work with that little part of the calcifications. We're gonna use the focus and the radial in the combination. But when we have this pain and this calcific deposit, there's most likely gonna be a more diffuse area of pain or affection to the tissue. So we're gonna start with the radial to work around the shoulder. We're gonna use the focus device and the radial on the specific calcification, and then we can end up using the EMTT to create a better circulation, to open up the cells so we can have a better effect. So we already see that with tendinopathy for Achilles tendon, we have better results combining focused and the EMTT. Now we have an option to create the better solution with EMTT, focus device, and the radial device. So this is a really breaking point for the science that we start having these studies coming out in the shockwave world with having better effect combining it. Just like when we've been looking into plantar fasciitis during many years, we know that laser can work. We know that focus device and radial can work. There's also been studies where they do the combination of level 4 laser and the focus device, showing that if you want to choose one of them for a non-responding chronic plantar fasciitis, then you're gonna go with the focus device. But if you combine the focus and the laser, then you'll have a better outcome. So in the same way here, think of EMTT in a way to enhance the effect of the shockwave device. And that's leading me directly into the plantar fasciitis. Also one of the good cases, you can see on the tendon how swollen it is. It's almost 6 millimeters. It's a bit more than 6 millimeters. Pain over several months. Haven't been responding to the rehabilitation, the classical exercise. With the device and the combination, we had a decrease in pain and an improved quality of life. So she could continue doing her rehabilitation, having more effect. Because in this case, we just needed to reboot the cell's connection. We need to induce mechanical transduction. We need to have this highway cleared of all the obstacles so we can start doing the proper healing again. So we have some very good opportunities of creating a difference in the tissue. The beauty of the EMTT is, of course, that if you're going to sum it up, that we have a wide variety of treatments we can do. We can work specifically with pain, and I'll say that pain is one of the most important things that we're working with in our field. We have basically no pain during the treatment. Of course, there is some areas where you can feel a bit of intensity, but like with the focus and the radial device, we just decrease intensity so the patient can endure it, because we're not interested in scaring them away. And and that goes for shockwave as well, if we do a lesser intensity, we can just compensate by adding more pulses so we have the same amount of energy put into the tissue. Then we also see that the combination of the focus device and the EMTT gives a better result, and it complements each other. So the EMTT is a kind of shockwave. We create a biological change to the tissue, and it enhances the effects. That is also what I've been seeing the last few years since I started working with the indication and the EMTT technology, is where I had good results with the focus device, I'm getting them faster now. Then we have the option of working with these more diffuse pains. So we have the non-specific back pain. I have pain in my entire shoulder or my entire neck. Then we can work with it very efficient because remember, when we have the coil, the energy is coming out on both sides and it's a very large field. That's also why you should please remove their credit cards or phone or other sensitive things if you're gonna work through the clothing, because you don't need to get the patients to undress. So you can put them in the waiting room, having the device on, and then be ready for you to come in, or you can do it after the treatment. We can reach these deeper regions, and usus pubis is where we have a very good study. But the other thing is that it's also extremely painful when we do this treatment with the focus device. Then we also have the hip flexors, also very deep laying. We have them on the anterior part of the spine. We can reach it with the radial device. We can reach it with the focus device, but we still need some treatment there. The same with the hip, osteoarthritis in the hip. When I work with my focus device, in most patients, I can reach the anterior part of the hip, but it can be difficult to go all the way down. We can do that with the EMTT. Then we have this very high comfort for you and me when we do the treatment because we have the holding arm. We don't need to do anything. That's also why that before I had the EMTT, I was always combining with the level 4 laser the same as before. Today, 99% of my use of laser has been replaced of the EMTT. So I have more time, I can work more efficient, and I don't have to sit like this all the time. You all know that when we work with these kinds of equipment, we actually use quite a lot of force and intensity to just do these small, very gentle movements. And that can also create tensions over 20, 30 years for us. So in this way, we have an easy way to apply. Then it's non-invasive, it's secure, there's no side effects. I haven't seen any side effects during these 3 years. I haven't even seen heating up of the tissue due to implant or due to a tattoo, but we always need to be aware of it. Also, if you have clients with different kinds of piercing, be aware that it can be affected. But then again, just tell them, let me know if you start feeling anything, because then we can abort the therapy right away. But I haven't seen any cases myself, and I think in total, there's been like 1 case of implant heating up to about 1 degree. Then it's cost effective. As I mentioned, I don't know what the price of the unit is in Greece, but I only been changing my coil once in these 3 years. So for me, it's been a quite cheap device. Then the next thing is, for me, service is everything. I have a service department 45 minutes from my clinic for the Shockwave equipment, the EMTT. And I can always just go up there with my equipment if I need to have a change of a coil or something. But with this one, when you get the equipment, after 23 million pulses, the device will tell you, now it's time to do the change of the coil. You're reaching these 25 million pulses. Then you just order it. It's going to be delivered to the clinic. You're going to do the replacement yourself. You don't even need to have your service technicians coming out. Of course, if they want to come and do it, they are more than welcome. It's always nice to see our partners, but we have the ability to do everything ourselves. So this was basically what I